And I'm going to be talking about antisocial personality disorder. So what is ASPD? People with this disorder tend to lie and break the laws, meaning they could rob a store or they could murder people. They act impulsively and aggressively, and they lack regard for their own safety and the safety of others. The key statistics of this disorder are that it is more common in men than it is in women, simply because women tend to feel more, they're drawn by their emotions. About 3% of men and 1% of women have this disorder. Approximately 80% of male inmates have this disorder, meaning 80% of males that are in jail have this disorder, while up to 65% of women who are imprisoned are with this disorder as well. So the Joker is a common face to most of you guys. He also has this disorder simply because he was neglected as a child. He acts irrationally and irresponsibly. He has no friends, no family, no connection. He disconnected himself from all of that because of what happened when he was younger, being abused by his father. Okay, relevant culture variations. The culture you come from could have an effect on having this disorder. So, for example, Caucasian people are more prone to drugs and abuse, so it's more common for them to develop this disorder because they're not centered around togetherness and family. They're more about drinking and independence. Where Hispanics are more together, and for them, therapy is like taboo. It's not something that they usually go to. They rather just deal with it as a family. So it's less common for Hispanics to have this disorder. Okay, so the causes of this disorder in a psychosocial way, it's actually unknown unless like acts of neglect and abuse through childhood. And also if your parent has this disorder or if your parent is an alcoholic, then that could give higher chances. Also if you're in an environment where you're not really talking to a lot of people, you could also develop this disorder. The biological causes is it's correlated with lower activity in the amygdala and the frontal cortex. The frontal cortex controls how you manage your emotions. So if you have lowered activity in this area along with the amygdala, then you'd basically be emotionless, and that's why you're more likely to have this disorder. So the symptoms of this disorder. So the people that have this disorder are manipulative, and if you have an opinion, they'll want to change your opinion to match their opinion, and they perform harmful acts to other people and to themselves. They break the law without any judgment, without even thinking about it, they just do it. They're inconsiderate of others' feelings, and they lie a lot. They're able to act comical in like the saddest situations, and things that other people would consider rude and just disrespectful, they would consider like hilarious. They're likely to take unnecessary risks and ignorant to consequences, and they develop poor abusive relationships, and they don't trust anyone, not friends or family, and they fail to meet all their responsibilities, such as jobs. So the common treatment options and their effectiveness. The treatment depends on the willingness of the person. Therapy is a big way to cope with this disorder, but a lot of people with this disorder would rather not go to therapy because they don't want to deal with the problem that they have. They don't want to realize that they have that problem in the first place. There is no official drug for this disorder, but doctors do prescribe anxiety and depression medications. Although people with this disorder are less likely to have anxiety, they don't feel nervousness, they don't feel like, oh, should I do that, should I not do that? They just do it. These are the sites that I used. Okay. All right, that is my presentation. Thank you very much for watching.